Welcome to the Industrial Talk Podcast with Scott McKenzie. Scott is a passionate industry professional dedicated to transferring cutting-edge, industry-focused innovations and trends while highlighting the men and women who keep the world moving. So put on your hard hat, grab your work boots, and let's go.
All right, welcome to the Industrial Talk Podcast, the number one industrial-related podcast in the universe. I don't think I'm overselling that one bit. If you think I am, just, go out to industrialtalk.com and let me know why. But it is it's a platform that celebrates you, industrial professionals, industrial heroes. You are bold, you are brave, you dare greatly. You innovate, you change the world, you solve problems, you're changing the lives, and boy, why not celebrate? And you know what? You're not just, you don't want that legacy thinking, baby. You're always just pushing it out there, making our lives better. Thank you very much. All right, in the hot seat, we've got a gentleman by the name of Jonathan Baktari, MD. And we're going to be talking about going back to work, trying to pursue getting back to normal. What does that look like? What does it mean? And he knows everything about what we were talking about, COVID, you name it, vaccination, what's important for doctors, really sound, sage advice. Let's get cracking with the interview. Yep. Great conversation. Timely. Big time timely. Big time timely. All right, we're about... We do not entertain legacy thinking here on this particular podcast, not one bit. Nope. Don't even ask me about it. We're always talking to people that are innovators, real trailblazers, people and companies that are committed to helping us have better lives. How about that? How about that for a noble cause? Now, Industrial Talk is all about education, industrial education. And Industrial Talk believes that it's through education that you're going to change lives and you're going to change the world. And I think what's taking place within Industry 4.0, all of the interesting digital transformation activities that are going out there, it's going to happen. It's going to happen big time. And it's a beautiful thing. And it's a great time to be alive. So in light of that, we've got an event that you need to put on your calendar. It's brought to you by those wonderful people at IoT Solutions World Congress and the Industrial Internet Consortium. This is October 5th through the 7th in the beautiful beautiful city of Barcelona. I've been there a couple of times, broadcast from there, looking to broadcast again from this particular event, October 5th through the 7th. They're going to be talking about IoT. They're going to be talking about AI. They're going to be talking about digital twins. They're going to be talking about robotics. And one that's pretty cool, quantum computing. How about them apples? They are always pushing the envelope. The people who go to this particular event push the envelope. It is a great opportunity to truly meet professionals that have a big heart and want to change the world. All right, the next one. The Manufacturing and Technology Show. This is in Cleveland, Ohio. Beautiful. By the way, Cleveland is a great place to go. I mean, it's a great town. It is November 9th through the 11th, and it is in Cleveland, like I said, and it's the Manufacturing and Technology Show. Again, let's get back to life. Let's get back to enjoying these wonderful events and highlighting the individuals. I'll be broadcasting there too as well, and talking to some of the biggest thinkers in manufacturing, the solutions, the technologies that they're deploying, the safety, all of that stuff will be at that event. And I'm telling you right now, Cleveland is a beautiful place. So put that down. I'm going to continue to remind you because it's way out there. It's a good opportunity to make sure that you put that in your plan. You got to do that. All right, on with the interview. Jonathan Baktari, MD. The last name is spelled Baktari. And he's an expert in the COVID situation, vaccine. He's got a couple of companies that cater to that. He knows what he's doing. And it's an interesting conversation because he also knows how to get you back to work, how to open the door, and what is right and what's good and all that fun stuff. Fabulous conversation. So enjoy my interview with Jonathan. Dr. Baktari, thank you very much for joining the Industrial Talk Podcast. I like your bookshelf behind you, and if you're looking out on the video, you can tell his setup is much better than my setup. How you doing there, Doctor?
Oh, wonderful. Thanks so much for having me.
All the way from Las Vegas, everybody. So it's getting warm, but it's still brings back great memories. For the listeners, just real quick, let's sort of level set on who you are. Give us a little background on a little 411 on who Dr. Baktari is, and then we're going to venture into COVID. I mean, it's the elephant in the room. Let's get going.
Sure. Hi. So I'm actually a internal medicine pulmonary critical care specialist. I ventured out into administrative medicine. I'm now the CEO of U.S. Drug Test Centers and E7 Health. And we're both of them are technology companies that we're really trying to take to the next level. And we've done a lot of amazing work. And here we are.
See, and I think this, listeners, I think this is a great conversation. It is timely. I see that, Doctor, that things are sort of getting a little looser, opening up. People are thinking about, from a business perspective, from an industrial perspective, what do we do? How do we return? So how has the world, from an overall perspective, how has the world changed in light of COVID, the pandemic, generally?
Well, I mean, obviously, it's been an experience we've all gone through. So I think a lot of the changes are practical. I mean, things that we're just going to have to do maybe slightly differently. And I think there's also been an emotional toll.
Yeah.
I always talk about how people who survived the Depression or World War II and what have you just came out different attitudes about things. So one, I think there's going to be some practical changes in the workplace potentially. And I think there's also going to just be some emotional residual impact of how people view things, simple things like handshaking or, lining up in a queue to get a hot dog or something.
Which I do like, and now that you bring that, I do like lining up in a queue for a good hot dog. So when we start talking about practical changes, give us some examples of other sort of practical changes, and then we're going to talk a little bit about returning to work and how do we deploy that. Give us some practical changes.
Well, I think the most practical change from a workplace is, I think we spend the last 30, 40 years making, indoor spaces more efficient and specifically energy efficient. And that's really counterintuitive to, from a COVID point of view in terms of safety, because a lot of that energy efficiency in buildings and even industrial spaces went to, minimizing air coming in from the outside and what have you. And so that's going to be a conversation people need to have, a balance between, creating energy efficient indoor spaces versus safe indoor spaces. So I think that's definitely on the forefront as we move forward.
That's an interesting change because you're right. You're absolutely spot on about the journey that we've been on from a sustainability perspective, and that is efficiency. And we've attempted to work the best we can, making these assets, these facilities, as energy as efficient. And you're saying that there might be a challenge there with COVID.
Yeah, I mean, certainly we know that's one of the reasons why COVID is so efficiently spread indoors and how hard it is to get it outdoors is the ventilation. So, whether the room air is exchanged once an hour or 6 times an hour, that matters when it comes to your employee safety.
So if my employer is saying, hey, You've been working from home. You've been doing a great job. Let's get back to normal. Let's come on back to my the office. How do I ensure that my workspace is safe? Given the fact that you're looking at your phone, I have tell us about that.
Yeah, I mean, obviously, the spacing is an issue. Well, once you can look at it two ways. If everyone's immunized, we have herd immunity. I guess you can think of that being providing you safety. But from just a industrial point of view and the space point of view, the less crowded you are and the more ventilation there is, and there's also you can add filtration. So if you put in a filtration system with a MERV 13 or higher filtration system, that's a good way to go. If you have more air exchange per hour, that's a good way to go. And of course, spacing people out. So that's on one side of the equation. The other side of the equation is, is everyone vaccinated and do we have herd immunity? I think in terms of safety, you can go at it both ways.
How do I know I have herd immunity? You brought that up, and define it. What does that mean? And then how do I know?
So when a vaccine is created, there's two ways you can be safe. One, if the vaccine is efficient and good and you get it, you're going to be safe. Now, if you were the only person in the United States to get the vaccine and nobody else got it, you could make the argument that eventually there would be a variant created because of everyone else getting the disease that your vaccine wouldn't protect you from. So once 70, 80, 90% of the population has been vaccinated or has had the disease, the virus just simply doesn't have enough people to jump from. So even if one person gets it, there isn't enough other people that it can jump to and propagate. So it's a dead end. Once 70, 80% of the population gets it, anyone who gets the virus has a difficult time transmitting it to someone else because ideally they're surrounded by people who've been immunized. So the vaccine, the virus sort of dies, in their body, and that's the end of the road for that virus. So herd immunity is this concept that the vast majority of the population have either been immunized or have had the disease, so they're protected from potentially rehabbing it. So now that assumes that no new variants come out and your immunity doesn't peter out. But putting those two assumptions aside, that's how you get herd immunity.
How is the COVID different from influenza? Because we always have the flu shot, right? Go get the flu shot. It's changed or it's different. It's evolved. How is it different?
We don't know yet. We don't know if it's seasonally going to change enough that you actually would need a new vaccine. That is the worry, that every year it might, mutate enough that you would need a new vaccine. And we know, for example, Pfizer and Moderna have already created a booster shot that covers, South African variant and the Brazilian variant. We don't know if it's needed because so far the current vaccine seems to be protecting against the variants, at least the vaccines in the United States that have been approved. So, but in theory, if those variants ever get to the point where the current vaccines don't cover them, then we'd have to get a potential booster shot.
So with this timely conversation on COVID and where we're going back to work, going back to this whatever next normal, whatever it looks like, and I would imagine, Doctor, that it's going to sort of just like anything else, it's going to sort of evolve and morph and people get a little smarter and a little bit better. Don't do that, do this, and all of that good stuff. What about travel? What about so here in Louisiana, we don't have a mask mandate, but if I go to New York or some other, there's a mask mandate. How do we manage the travel in this particular world?
Well, travel I think is going to continue to evolve as we go back to what I was talking about earlier, the herd immunity. The closer we get to herd immunity, the less some of this physical barrier will become an issue. I'm not saying it'll go away completely, but if we were at, let's say, 80% by July of the country having the vaccine or the infection, some of these barrier methods will become less significant. Now, are there people who will want to just have that extra protection? Of course. I know Dr. Fauci was on TV yesterday saying that, it's a good idea to wear it even because it might protect you from the seasonal flu, which, 40,000 Americans or so die from every year. So, will this change and people will wear a mask, during the flu season just in general to protect themselves from the flu? Maybe, or people are going to be extra cautious. So a lot of that is really going to depend on individual decisions. But I think from a public health point of view, some of these mandates are probably going to start to go away as we get closer to herd immunity, assuming no new variants come out.
So just to quickly recap, we're going to venture into another conversation, but to quickly recap, if you're returning back to work, have that conversation about good ventilation. I think that that's a good thing to do if you want to return back to work safely. right?
And or filtration. I mean,
Or
it's
filtration.
a combination of, you can have ventilation or you can install, or both.
That's right. And then from a vaccination point of view, if your organization has 80, whatever, 90% vaccinated, I think those are two good things to just sort of ask your employer, right?
Yeah. Well, I mean, if your employer is collecting that kind of data, but they may not be.
Is there any laws against that? An employer collecting whether you've been vaccinated or not? Seems a little intrusive, huh?
Well, it depends on the motive. Like, for example, if you want to get a job at a hospital or a nursing home, not only will they ask you, they'll ask you to prove it. And if not, they'll offer to give it to you as a condition of working there. So we already have that in essence. Like, you can't even work in the kitchen of a hospital or a rehab center without having all those vaccines and proving it. So it really has to do, and I think the hospitals make the case because they're trying to protect the patients. And so if you can prove that there's a safety reason for you wanting that information or mandating it, then you can, because that already exists. I think the issue is going to be, can you make an argument that you need this information and you need to mandate it for the safety of someone in the organization. So, but yeah, the precedent is already there.
So let's talk a little bit about. I've heard that there are 3 vaccines. Am I right? So there's 3 vaccines.
Right, Moderna, Pfizer, and Johnson and Johnson.
All of them effective?
Yeah. Well, it depends what your definition of effective is. If your definition is, will it keep me from dying from COVID? Yes, all 3 of them will 99% keep you from dying from COVID if you get it. So if that's the endpoint of effective, yes.
But I have 3 options. What do you recommend? I don't know which one you recommend.
That's a really good question. I recommend you take the vaccine that someone's offering to put into your arm. The first one. Because while you're waiting for the perfect one, you may actually catch COVID.
See, that's a great answer. Well done, because you're straddling that political fence. You don't want to just sit there and
Well, it's true. Honestly, I know when I got mine, I mean, I don't care whatever they would have said to me. I'm like, I'm in, give it to me. Because you can't, first of all, there isn't that much of a difference. But second of all, while you're waiting for the perfect one, you could catch COVID.
Right.
So it's sort of like, the plane you want to catch is the plane that's taking off now.
That's true.
Not the plane that, may serve the best dinner later on.
That's a good analogy. I have to agree with you. I can't argue about that. So let's talk a little bit about technology in this particular area. Now, we prior to our conversation, we talked about U.S. drug testing centers, 1, or E7 Health, right?
Yes.
2. And
Yes.
what differentiates, because what I see here in this world of COVID, in this pandemic, in this is a tsunami of data and management of that data.
Right.
And it's like, as a business owner, this would just be overwhelming, right? Mm-hmm. But you and your team at these organizations have come up with a pretty nifty way of leveraging innovation, leveraging technology to make my life, me, business owner, happy and safe. Can you explain a little bit about that?
Yeah, I mean, really, I tell people we're in both companies, we're really technology companies masquerading as, drug testing companies or healthcare companies. And at the U.S. drug test centers, we've really taken the entire industry of drug testing and put it on the cloud and come up with customizable solutions for different industries and different companies. So they don't have to be in the drug testing business. We want to take people out of the business. When you hire a cleaning crew to clean your facility, you don't want to get in the cleaning business. You don't want to find out about all the different detergents that you could use. And same thing, whatever vendor you hire, you don't want to learn their industry. And so what we found is a lot of people who hire drug testing companies in some level, they have to create a whole department to manage it, to manage the data, to manage different locations and who has access to what, and also to have a repository for all this information. And so we basically created a cloud-based solution where we do all of that for our clients. And literally, they're out of our business, and they just get use of drug testing for what they need. And
interesting. So old way would be, hey, go down to this drug testing center. Then I'd have to, me, company owner, have to interact with it and figure out and get some information. And there's a dialogue there.
Right.
But what you're saying from a frictionless point of view,
right?
Just go here and all I have to do is I have a historical account of the guy or
right.
But I just access it from the cloud. Is that correct?
Right. I mean, the way our system works, you can literally send 20,000 different potential employees a link, and they can pick their own drug testing center, any one of 20,000 collection centers, and literally you don't have to interact with them. They can pick it, go, and they'll have a donor pass, and then the results will come from all 20,000 collection centers in every city, every state in the United States will come back to your cloud-based software, usually in 24 hours if the tests are negative. And you'll have them there. You don't need to print them, scan them, file them away. There's no fax. And that's just one thing you have control of just right there.
I like the fact that you're aggregating all of these test sites. Listeners, we were just having this conversation offline, and in Mandeville, as quickly as blinking my eyes, Dr. Baktari just pulled up 4 locations that are associated with what U.S. drug testing centers are all about. 4, right there, boom, there, here, and here, and relatively close. And all he did was just say, "Where are you from?" "Oh, Mandeville." "Okay, there." It's just that simple. And as a former business owner of an industrial maintenance company, I wish he was around for me to have this conversation, because that is a very big part of my time. Where do you see it going? I mean, where do you put your future hat on? Where do you see it going?
Well, with the drug testing, I think what we really want to be able to do is we want, like you have used one of our favorite terms, we just want to remove every aspect of friction in the whole system. Also, from the employee side, we just want everyone to move on and do what they're supposed to be doing and not be involved in, the best. I hate to use it. The best toupee is the one you can't recognize. I mean, you don't want to be involved in the drug testing world. You don't want to know you're in the drug testing world. You just want to serve your purpose. So we will do everything. We're going to write your policy for you. We're going to help you manage any audits you have. We're going to have every aspect that you would need if you had a drug-free workplace program. So you don't have to be involved at all, and your employees don't have to be involved, and you have access to whatever you want, whenever you want it. Years later, theoretically decades later, we will have everything stored away. So if you go into legal issues, audit issues, we have everything at your fingertips. You never have to wonder or go look for something.
Wow, that's powerful, because you're absolutely right. You're asking me, pre your solution, you're asking me to hold on to these files for whatever period of time. There's a safety component associated with it. Of course, a legal component associated with it. I mean, you've just, in essence, just removed that whole layer of frustration in my life.
Right. That's our goal. And and the only way to do it, I don't think we could have done this 10 years ago. The only way we are able to do it is the amazing technology and software we've been able to produce. I mean, it's something that it couldn't have happened until the cloud got to this level, and so we're really fortunate.
Yeah, it was interesting. What I like your value proposition is, I remember having to send some of my employees to get tested, right? And the only place that I could go is like, you have to go over here. And that wherever here was inconvenient for that individual. And it was like, no, that's where you got to go. Well, I don't have it. Now you got to go there.
Right.
You've removed that too.
Completely, because they actually pick it themselves.
Yeah. There's no, you can't come back to me and whine why it's too far away. Well, pick another one. Pick another one.
Right.
I love that.
Right. And also they don't have to call them or make an appointment. Our donor pass that we send them is all they need to walk in with. So they don't have to interact with the place either. They just have to, they don't have to call and say, hey, whatever. Right. They can just walk in. And that was really what we were trying to achieve. We were wondering if we could do this nationwide in every small town, every city, every state in the country.
Wow. Beautiful solution. I love that. How does that differ from E7 Health? What's that all about?
Yeah, so E7 Health, is again deals a lot with employers and schools, allied health schools, and organizations that have traditionally a lot of preventative health and wellness they need as part of their organization, whether it's to keep their employees safe, to comply with regulatory requirements. And so what we did at E7 is, one, we decided not to do primary care or urgent care. So if somebody comes in and their tummy hurts, we will not see them. We'll of course refer them to a great primary care doctor, but we won't see them. Instead, what we did is focus all our technology and software development in streamlining and providing a solution for healthcare companies, defense firms, all sorts of industries that need preventive health and wellness services for their employees, students, and organizational members. Again, on the cloud with company portals. So, like for example, our software will allow a company that has 4 or 5 locations to keep track of the records of all their employees. It will come back to their portal, and they'll know exactly who has and has not had any particular service for that year, whether they need to get yearly flu shots, TB skin tests, physicals, hearing tests, vision tests. We will have all that at the company's fingertips so they can control that. And they get audited or the regulatory body comes in and says, provide us with all this data. Again, they're not in the data management business. We already have all that stuff for them.
Love it. I could go on for a long time. How does somebody, get a hold of Dr. Baktari, U.S. Drug Testing Centers, E7 Health, all of the wonderful solutions that you and your team provide? How do they get a hold of you?
Well, the easiest way is just go to BaktariMD.com, and both those companies there, as well as some information about us. And I'm on LinkedIn and all the social media platforms, but either BaktariMD or LinkedIn, or you can go to e7health.com or usdrugtestcenters.com. All
right, listeners, the last name is spelled Baktari. Slap an MD on there, and at .com you'll be able to find Dr. Lickety Split right there. And but fear not, you're going to have it out on industrialtalk.com, so no excuses. We are removing, just like the wonderful team at U.S. Drug Testing Centers as well as E7 Health, removing all the frictions of getting that information ASAP. Thank you, Doctor. This was a great conversation.
Pleasure. Thank you so much for having me.
Super timely. All right, listeners, again, we're going to wrap it up on the other side, so fear not, we're going to have all the contact information of Dr. Baktari, so stay tuned.
You're listening to the Industrial Talk Podcast Network.
All right, I'd like to thank Jonathan Baktari, MD. Dr. Jonathan, thank you very much, sharing your sage insights into how we in industry can get back to work, knowing exactly what's going on out there in the world of pandemic. Nailed it. Absolutely wonderful conversation. Reminder, everybody, put this on your calendar. This is the IoT Solutions World Congress and Industrial Internet Consortium, October 5th through the 7th. They're going to be talking about IoT, AI, 5G, and everything in between. Fabulous opportunity, beautiful Barcelona. The other one is, of course, the Manufacturing and Technology Show, November 9th through the 11th. And that is this year. Cleveland, Ohio. Great town. Gotta go there. We went there last year and it was great. All right. Again, We're about education. The Industrial Talk is about education. It's about believing that education and industrial education can change the world of things. Hang out with people who are bold and brave and daring greatly, and you will change the world as well. Thank you very much for joining. We're going to have a great interview shortly.